today's session. So, myself Rajita, and here we are again came with a very new topic, and it is also a very important topic of medical surgical nursing. So, I guess in the previous session we have already discussed regarding the fluid and electrolytes and its balance or the maintenance of fluid and electrolyte, right? We have studied there what do you mean by fluid, what are the main components of it, what are the electrolytes present in our body normally, what are the compartments like the extracellular and intracellular compartments, there the fluids and electrolytes are present. Now we have also learned about the normal mechanism, how the fluid electrolyte is getting balanced or maintaining the balance inside an individual's body. Now, as we have told that here we are going to discuss now regarding a condition where we are going to see the homeostasis of the body is going to be disrupted due to certain disease process or certain pathological conditions. Now here, as the disruption of the homeostasis is taking place, we are going to see that the fluid and electrolyte here will not be able to maintain in a normal balance, or that is the reason we are going to see an individual with certain illness or disease condition may develop with fluid and electrolyte imbalance. So in this session, we are going to discuss in detail regarding what do you mean by fluid and electrolyte imbalance, what are the different type of fluid and electrolyte imbalance can be present or are commonly seen among the patient in a clinical setup, as well as their causes, clinical manifestations, and the basic nursing management and treatment modalities to manage the fluid electrolyte imbalance. So let's get started with the topic today. Now, imbalance of the fluid and electrolyte can occur in individual's body basically with the presence of major illness. The major illness and injury often will be disrupting the homeostatic level, right? So as we have learned, the injury can actually cause loss of blood or loss of fluid from the body. Even certain major illness like the disease of heart or certain disease which is disrupting the functional ability of the kidney, we are going to see this major illness will be often disrupting the fluid electrolyte balance, because we have already learned regarding the regulations of fluid and electrolyte. There we have seen the cardiac regulations, the regulations by kidney, even the pituitary hypothalamus regulation plays a very important role in the maintenance of the balance. Now here, because of the major illness, if this regulatory mechanisms are getting disrupted, we are going to see that the person or the particular individual will be losing lots of amount of fluid or maybe blood, and the person may develop acute fluid electrolyte imbalance. Now, as I mentioned, some electrolyte or fluid electrolyte imbalance will be occurring due to a direct etiological factor or direct illness. Now, this direct illness often cause burns, heart failure, even kidney failure. Now, this all are the disease conditions which will be directly causing a fluid electrolyte imbalance. Whereas for some individual, we are going to see the therapeutic measures also will be indirectly causing the fluid electrolyte imbalance in individual's body. Now, therapeutic measures include the IV or intravenous fluid administration or maybe fluid replacement, a procedure of blood transfusion, even usage of certain medications, especially usage of diuretics. Now, this therapeutic measures actually can cause disruption in the fluid electrolyte balance. Now, perioperative clients are also considered to be have a high risk for the development of fluid electrolyte balance. Now here you need to get the idea that as a person is going for a surgery, they're having a probability to lose maximum amount of fluid and blood. That is the reason we are considered that a person or a perioperative client often will be having high risk for the development of fluid electrolyte imbalance. Even clients who are unconscious and semi-conscious, for them also it is a very high risk for the development of fluid electrolyte imbalance. A person who are having a chronic major illness or maybe a acute traumatic injury, they are also having a high risk for the development of the fluid electrolyte imbalance. Now, this condition of fluid electrolyte imbalance is very commonly seen among the client who are seeking medical care and present in a clinical setup. That is the reason why, as a nurse or as a medical professional, we should learn about the detail of fluid electrolyte imbalance and its management. So you need to make it clear that it is a condition which is basically preventable and manageable if recognized at earliest. That is the reason we are going to learn in detail regarding each and every fluid electrolyte imbalance which can occur or which are commonly seen, even its treatment and management. Now, imbalance which generally occurs in individual's body are commonly divided into two different categories. The one or first category, we are naming it as the deficiency or deficient fluid volume. So here basically we are going to see the fluid or the electrolyte will be present inside the individual's body but will be having a decreased amount of volume compared to a normal level. So this particular imbalance, we are calling it as a deficit. Now, another category of the fluid electrolyte imbalance is if there is excess amount of the presence of fluid and electrolyte in the body. Now, you need to make it clear that to maintain the homeostasis in the body, the fluid and electrolyte should be present in a proper amount only or within a level only. Now, if the fluid and electrolyte is getting increased or maybe decreased compared to the normal level, we are going to see the person will develop certain pathological conditions, even the clinical manifestations. That is the reason here we are going to describe the fluid and electrolyte imbalance in two different categories. That is, an excess amount of fluid and electrolyte present and a deficient fluid electrolyte, which both can manifest as a pathological condition for an individual's body. Now, it is very commonly seen among the clinical setup that for a particular individual, often combination of different fluid electrolyte imbalance can be present, or we can say in a simple term, more than one imbalance or fluid electrolyte imbalance will be often seen in a particular individual patient in clinical setup. So here we are going to discuss regarding the extracellular fluid volume imbalance. So as we have learned, the fluid will be definitely present in two compartments, that is the extracellular and intracellular compartment. First, here we are going to learn about the extracellular fluid volume imbalance. So you have to learn two basic terminologies in the imbalance of extracellular fluid. First terminology, which is termed as hypovolemia. Now, if there is a extracellular fluid volume deficiency in an individual's body, we are calling that particular condition as hypovolemia. Whereas we are going to use the second terminology as hypervolemia. It is basically indicating if a person or an individual is having excess amount of extracellular fluid present in their body. So I hope you are completely understood this two concept of hypovolemia, where we are going to see the person will be present with deficient amount of extracellular fluid, and the second terminology is hypervolemia. It is a condition which is indicating that person is having excess amount of extracellular fluid in their body. Now, extracellular fluid volume imbalance. Now, it can be hypovolemia, even it can be hypervolemia, typically will be accompanied by one or more electrolyte imbalance. Now, this imbalance of extracellular fluid is very common clinical condition which are often related with major illness, traumatic injury, and many other conditions of a clinical setup. Particularly often we are going to see the hypovolemia and hypervolemia will be present associated with the imbalance in the sodium level as well. So that is how we are going to see the client will often show the feature of hypovolemia and hypervolemia in a clinical practice. So as we have learned, first we are going to see about the hypovolemia, which is basically a fluid volume deficit in an individual's body, right? So here the fluid volume deficit is not interchangeable with the term dehydration. Often we are going to call the fluid electrolyte deficient or the fluid volume deficit as dehydration. But you need to make it clear the fluid volume deficit is not interchangeable term along with dehydration. Dehydration is a completely different concept altogether. Now basically when we are going to term the condition as dehydration, we indicate that it is indicating a condition where there is loss of pure water or pure fluid without the presence of electrolyte. But fluid volume deficit often will be indicating the loss of water or fluid from the body along with some amount of electrolyte. So that is a basic difference between the fluid volume deficit and dehydration. Now, what are the causes which can include the development of hypovolemia for a patient? Let us study here. Now, the first causes which is very commonly seen among the client is increased sensible water loss or perspiration. Now, many of the disease conditions or inner conditions where a person is having excess amount of insensible water loss, we are going to see they will be having high risk of development of hypovolemia. Diabetic insipidus. This is also a condition where we are going to see the client will be having high risk of the development of hypovolemia because the person with diabetic insipidus often will be having increased urinary output. Now, increased urinary excretion of the fluid from the body will definitely cause decreased amount of fluid volume. That is the reason here a person will be having high risk for the development of fluid electrolyte deficit. Now we are going to see the osmotic diuresis often will be causing the fluid volume deficit in an individual's body. Now, osmotic diuresis basically will be causing excess amount of urine production. That is the reason here the person will be often present with excess urinary output and they will be going under development of hypovolemia. The next conditions which is very often associated with the hypovolemia is hemorrhage. Now, as we know, in hemorrhage there will be a direct loss of the blood, even the fluid, right, or plasma. So definitely a person here can develop a hypovolemia soon if the hemorrhage is severe enough and if it is not managed at earliest. Gastrointestinal losses through vomiting or excessive diarrhea or nasogastric tube suctioning. Often this will be causing the presence or the development of hypovolemia for client who were present in a clinical setup. Now, often diarrhea or excessive diarrhea and excessive vomiting can cause hypovolemia. As we have learned, now in diarrhea and in vomiting, our client is directly losing the fluids from their body. That is the reason they can develop with hypovolemia in this case. The next condition is overuse of diuretics. Now, diuretics, as we know, it is a medications which is generally used to promote the production of urinary output for an individual's body. Now, if we are seeing that there is an overuse of this particular drug of diuretics for a client, they might have a high risk for the development of hypovolemia as an effect of the diuretics usage, the person will be having excessive amount of urinary production. So the last session we have read that basically the inadequate fluid intake often can cause or often can lead to the imbalance of the fluid volume, because you need to remember the thirst mechanism of a particular individual often considered is a very important part to maintenance of the balance of the fluid balance volume in the body. Here, once the thirst mechanism is alternating, or maybe due to some reason the person is not following inadequate intake of fluid, we are often going to see the volume will be decreased for the particular person and they may develop the hypovolemia. The third spacing of the fluid is the next cause which can lead to the hypovolemia. So as we have learned in the previous session, that third spacing is basically trapping of the fluid into the particular location within the body from where the exchange of the fluid with the other part of the extracellular fluid is highly impossible. Now, basically, the trapping of the fluid is causing unusage amount of fluid volume accumulation in the body. That is the reason if there is presence of excessive third spacing, like in case of burns or maybe intestinal obstructions, or where a person is developing with ascites, peritonitis, we are going to see the third spacing of the fluid here will be definitely causing a hypovolemia or availability of fluid volume in the circulation and the body. So as we have learned here the basic causes of hypovolemia, now we are going to learn the basic or the common clinical manifestations which often will be present in a client with hypovolemia. Now the clinical manifestations are restlessness. Restlessness often seen among the client with hypovolemia. Now, this can occur due to the inadequate supply of oxygen and nutrients to the body cells. The next clinical manifestations which are very commonly seen among the client with hypovolemia is drowsiness. So often drowsiness and lethargy will be accompanying the condition of hypovolemia, because you need to understand here a person is going in a state where there is deficient fluid volume is present. Definitely the body tissues or the cells will not be getting adequate amount of nutrients here. Disruption of the supply of the nutrients to the body cells will often cause the manifestations of lethargy as well as drowsiness. Confusion often will be seen among the client if the hypovolemia is severe enough. So basically in hypovolemia, as the volume is decreasing, the circulation also will be disrupted. Now in severe cases where the person is not managed or having a progressed stage of hypovolemia, we are going to see the cerebral circulation will be disrupted here. That is the reason a person may show the feature of confusion. Excessive thirst. So as the body will be in a state where there is fluid volume deficient, so already in last session we have seen that definitely this fluid volume deficit will be causing increased the thirst mechanism or increased activity of the thirst mechanism. So in the same way here we are going to see the client will be having excessive thirst. Now, dry mucous membrane often seen among the client with hypovolemia. Even decreased skin turgor, if you are doing a skin assessment, is a very prominent sign and finding on the physical assessment for a client with hypovolemia. As here the volume will be less, that is the reason even the skin will be losing its turgor. Decrease in the capillary refill is also a very common feature when you are performing a physical assessment on the client with hypovolemia. The other symptoms include postural hypotensions, even increased pulse often or increased heart rate often will be seen among the client with hypovolemia. On assessment for a client with severe hypovolemia, we are going to see there will be decreased central venous pressure. Even on assessment, the urinary output will be decreased for a client with hypovolemia. Concentrated urine often will seen among the client with the presence of hypovolemia. So basically the gravity of the urine here, or the specific gravity of the urine here, will be increased on assessment. Next, we're going to see the person often will be present with increased respiratory rate as well as increased heart rate due to the development of hypovolemia. A client with hypovolemia often will be present with dizziness. There can be development of seizure even. So as we have learned, the circulation may disrupt into the cerebrovascular area. So definitely as the perfusion is decreasing there, a client with hypovolemia can develop further with seizures. Weight loss for a patient with chronic hypovolemia is a very common manifestations. Even in severe term where the hypovolemia has progressed to a extent, we can even see the person or the client is going for coma or development of unconsciousness completely due to the disruption of the cerebrovascular perfusion. Now we are going to discuss regarding the collaborative care to manage a client with hypovolemia. So definitely the goal here to manage a client with hypovolemia is to manage the fluid volume deficit. So basically, primarily we are going to see on collaborative care, we are going to treat the client based on their disease condition. So the primary role of a medical professional here is to identify the reason behind the development of hypovolemia, and the correction of the particular illness or disease often will be saving the client for the development of hypovolemia. The next goal is definitely replacement of water and electrolyte in case of hypovolemia. So to replace the fluid and electrolyte for a client with hypovolemia, we are going to see the usage of balanced intravenous solution usage. So often here we are going to see the usage of lactate bringers solution usually will be administered to the client to manage the condition of hypovolemia. Isotonic sodium chloride. So this particular solution of isotonic sodium chloride often will be administered to or to promote the rapid volume replacement if it is indicated for our client. So I hope you got the idea that basically depending on the client's conditions, we are going to administer the fluid. So as mostly or generally, we are going to see the lactate ringer solution and isotonic sodium chloride solution will be used or will be administered for the fluid replacement. Now, in case of an acute blood loss where the person is going for a severe hemorrhage, or maybe a case of traumatic injury where the person has lost blood, we are going to see the blood transfusion here plays a very important role to manage the hypovolemia. So I hope now you're completely aware regarding the fluid volume deficit. The next condition we are going to learn is the fluid volume excess. So if there is the presence of hypervolemia, what are the basic causes and manifestations associated with it, and what is the basic management and treatment or collaborative care to manage the client with hypervolemia. So as now we are going to see about the fluid volume excess. So you need to remember that this condition for patient may result if there is excessive intake of fluids and abnormal retention of it. So basically, excess of fluid volume will occur in a patient when there is adequate or excessive amount of fluid intake, but there is no proper output of it, as well as abnormal retention of fluid inside the body. Then only we are going to see there will be fluid volume excess. Now, in some cases, basically some disorders or diseases will often cause this fluid volume excess. For example, heart failure. It is a condition where we are going to see, although the heart is not able to pump the blood adequately, there will be accumulation of the fluid or excess fluid volume retention in the body, which is ultimately will be causing a altogether a condition where there will be presence of fluid volume excess. The next condition is renal failure. So as we all know, the renal failure or the renal system is very much important to regulate the blood volume in the body. So what happens here in renal failure, as the kidneys are not functioning properly, we are definitely going to see there will be retention of excess amount of fluid in the body. That is the reason a person will be developed with a fluid volume excess. Even if there is any abnormal shift of the fluid from the interstitial space towards the plasma fluid, we are going to see a person can develop with this condition. But in case of fluid, if it is converting or transporting from the interstitial spaces to the plasma fluid, we are going to see the all over fluid volume will not be changed, but here the intravascular volume is increased. That is the reason a person may develop with the signs and symptoms related to this condition. So now we are going to read the acute causes which can lie behind the development of fluid volume excess. So the first one is definitely the excessive isotonic or hypotonic IV or intravenous fluid administration. Now, if we are going to administer excessive amount of isotonic and hypotonic intravenous fluid for some client, we are going to see they will be having a chance or high risk for the development of the fluid volume excess in their body. The conditions like heart failure, renal failure, always will be developing the condition of this. So already we have discussed here the heart failure and kidney failure is basically disrupting the regulations of the fluid volume balance in the body. That is the reason a person in a severe conditions of this disease may develop fluid volume excess in their body. The next condition is primary polydipsia. So in primary polydipsia, we are going to see the person is taking a lot amount of water. So this is basically caused because of the alteration in the thirst mechanism, where we're going to see the client can develop with a acute excess amount of fluid in their body. The next syndrome is termed as syndrome of inappropriate antidiuretic hormone production. So generally in our body, the antidiuretic hormone will be producing and it will be maintaining the urine output. Here, in syndrome of inappropriate antidiuretic hormone secretion or production will be often related to the alteration in the urinary production for a particular individual. Here, as the antidiuretic hormone is not producing an adequate amount, we're going to see the client will be having decreased urinary output probably. That is the reason a person can develop with excess fluid volume in their body. Cushing syndrome and a condition where a person is on or continuously using corticosteroids, they will be also have a high risk for the development of fluid volume excess for their body. Now, as we have learned the causes, now we should learn about the general clinical manifestations which will be often seen among the clients with a fluid volume excess or hypervolemia. So the first and foremost common important clinical manifestations for a client with hypervolemia is headache. So they will be often having alteration into the mental status as well as the cerebrovascular perfusion. So headache is a very common clinical manifestations for the client with the condition of hypervolemia. Confusion and lethargy is also commonly seen among the clients who are suffering from hypervolemia. Now, although there is adequate or excess amount of extracellular fluid, but you need to understand these fluids are not able to meet the need of the cells and tissues. So that is the reason why person are developing with these symptoms. So as I have mentioned, as happening in the third shifting, that the fluid are basically getting trapped where these fluids are not able to used by the body's need. That is the reason in fluid volume excess we are going to see the person can develop with various clinical manifestations. So the next common clinical manifestations associated with the hypervolemia is peripheral edema. So we're often going to see here as the fluid accumulation will be taking place extracellularly. That is the reason peripheral edema may often occur for a client with hypervolemia. The next condition is the jugular venous distension, which is a very common significant manifestations of right-sided heart failure. Here, what is basically happening, as we have learned, the intravascular fluid volume is excessively increased. That is the reason the jugular venous pressure will be increased and there will be distension of the jugular vein. Bounding pulse and an increased blood pressure is a very common manifestations for a client with hypervolemia. Increased central venous pressure often will be seen among the client with hypervolemia. The next common manifestations is polyuria. So in a case where there is development of acute excess of fluid volume, definitely a client may show the feature of polyuria. Dyspnea will often occur among the client with hypervolemia because you need to understand the excess amount of fluid volume in the body will also cause some amount of pulmonary congestion. Now, due to that, a person may show the symptoms of dyspnea or difficulty in breathing here in this case of hypervolemia. Pulmonary edema may be present if the fluid volume excess in a severe level, as well as on auscultation while performing a physical examination. Often our client will be present with crackles. So basically on auscultation of the lung, we are going to hear the sound of crackles as there is development of pulmonary congestion due to excess amount of fluid volume in the body. Now, muscle spasm can occur for a client with a hypervolemia. Even weight gain is a very common feature among them. So as the client here is present with excess amount of fluid balance, so definitely we are going to see the client will be having a acute weight gain. Even in case of hypervolemia also, we can see a person may develop the symptoms like seizure. Even a person can go for coma stage. Now, why this is occurring? Because as there is excessive amount of fluid collection in the intravascularly, sometimes increased blood pressure also will be causing disruption in the blood flow into the cerebral circulation. So that is the reason why there will be disruption of the cerebrovascular perfusion. So definitely we are going to see if there is excess amount of intravascular blood pressure, the blood circulation will be disrupted into the cerebrovascular space, and definitely there will be disruption of the cerebrovascular perfusion. That is the reason a client will be developed with the symptoms like seizure. Even the person can go for a coma stage. So as we have learned the clinical manifestations, so here also you need to remember that this conditions is manageable and preventable if the treatment is initiated at earliest. So the goal of the treatment for the conditions of hypervolemia often will be including the removal of the excess fluid from the body. Also here it is to be noted that while removing the body fluid, definitely the goal should be focusing on not to change the electrolyte composition and the osmolarity of the extracellular fluid. So as a medical professionals, it is a very important role here to identify the causes and the disease process which is basically causing the development of hypervolemia. Identifying the causes and treating the particular causes often will be showing a development or prevention of the development of this condition. Now, the primary form of therapy for hypervolemia often includes the fluid restrictions. So a client with a condition where they are having high risk for the development of hypervolemia, or a client who is already present with a development of hypervolemia, the fluid restrictions is the basic and initial therapy that has to be ensured. The next part of the therapy often includes the usage of diuretics. So often administration of the drug diuretics will be helping to removing maximum amount of excess fluid that is present in an individual's body. Now we are going to see restrictions of sodium intake often will be suggested for a client who is present with a high risk of the development of hypervolemia or who are already present with the development of hypervolemia. Next, we are going to see some procedures will be performed. So, for example, if the client is present with ascites, we are going to do the paracentesis for them to remove the excess amount of fluid that has been accumulated abnormally. Even in case of pleural effusion, we are going to see the pleural or chest tube drainage often will be indicated for the client. So similarly, depending on the client condition, where the fluid accumulation has taken place, and if they're not responded or responsive towards the basic treatment like the fluid restrictions as well as the diuretic therapy, definitely we are going to see some surgical procedures or minimal surgical procedures like paracentesis or pleural effusion or chest tube drainage will be indicated here to remove the excess amount of fluid from the body in order to maintain the fluid electrolyte balance for the particular individual. So I hope till here you are completely aware regarding the imbalance of fluid, where basically we are going to see the fluid volume excess and the deficit of fluid volume for a particular individual. We term these conditions and hypervolemia and hypovolemia. So we have seen the basic causes, the clinical manifestations, and the collaborative care to manage a client with hypovolemia as well as hypervolemia. Now we are going to learn regarding the basic nursing responsibility to manage the client with these two states. So it is a nurse's role to perform a physical examination as well as a performance of history collection. History collection and physical examination plays here a very important role. So collection of history definitely includes a past and present medical and surgical history, a family history, and as well as a lifestyle history of the client or the history of the habits of the client. Here, basically, the collection of data helps the nurse to identify the high risk, which can be indicating the causative agent, which is basically causing the development of hypo and hypervolemia. So that is how, through the history collections, our nurses will be finding out all the high risk indicators. Next, we are going to perform on every patient the physical examination. Definitely on physical examination, it has to be noted whether the person is showing any sign and symptoms related to fluid volume excess or deficit. Often on physical examination, if a client is present with fluid volume deficit, we are going to see their skin turgor will be reduced as well as their capillary refill time may increase, as well as all the clinical manifestations what we have read that the person may present with an increased heart rate or maybe their respiratory rate will increase in case of fluid volume deficit. Whereas in fluid volume excess, we are going to see the person may be present with peripheral edemas, even they can present with increased or jugular venous distension. There will be often increased central venous pressure and blood pressure even. A person may show other features as well, like the presence of crackles on auscultation over the chests or lungs often will be seen. Even the person can show the features of dyspnea in case of fluid volume excess. That is how, through the physical examination, our nurses have to note down all the indicating sign and symptoms which is related to the hypo or hypervolemia. Now, often a client who is present with hypovolemia, we are going to see certain common problems which are almost always found for those patients with hypovolemia. So the first problem is deficiency of fluid volume due to the excess loss of it. So definitely a nurse should definitely include or prioritize this particular problem to plan an action to minimize the reduction or minimize the losses of the fluid abnormally, as well as to maintain a proper fluid volume for a particular individual. Here, nurses also will be finding often that there can be chances of the decrease of the cardiac output. So definitely we are going to see it is a nurse's role to identify this problem and risk for the patient and ensure that the cardiac output is maintained adequately for our client with hypovolemia. Now, as a potential complication, always we will note that the person may develop with a hypovolemic shock in case of this disease condition. So, a nurse should prioritize the need of the client in order to plan a effective nursing care. In case of a client with hypervolemia, similarly, we are going to see a nurses will be identifying the common problems. Now, the common problems specifically include excess fluid volume in the body due to the increased water and sodium retention often. The next problem, which is very commonly found among the client with hypervolemia, is impaired gas exchange. Now, often with hypervolemia, a client will be present with pulmonary congestion and edema. Due to that, there can be impaired gas exchange. So, it is a nurse's role to identify the risk of the development of impaired gas exchange as well as to ensure that the client is maintaining a proper and adequate amount of gas exchange in their body. Even a very common complication in case of a patient with hypervolemia is the alteration into the skin integrity. So, as a nurse, we need to take care of the skin, even assess the skin at a regular interval to prevent the injury or any alteration to the skin integrity. Activity intolerance, or the person with hypervolemia often will not be able to perform the activity due to the presence of peripheral edema. So it is a nurse's role to confirm the person is able to active or able to perform the daily activity of living. Even a nurse here will definitely be assisting the client to perform their activity of daily living. Now, potential complications related to this hypervolemia often includes the complication like pulmonary edema or ascites. So, it is a nurse's role to ensure that the client is prevented for the development of this complication. So that is how a nurse is going to find out the probable and the actual complications and symptoms or problems that are present for the client with hypovolemia and hypervolemia. Depending on that, definitely a nurses will be forming the nursing care plan and they will be implementing it in order to promote the condition of the client. So generally, the nursing implementation for both the patient of hypovolemia and hypervolemia includes very common steps. Now, the first important nurse's role or implementation is the maintenance of an intake-output chart. It plays a very important role here. As we know, in hypovolemia and hypervolemia, there is alteration into the intake and output. Basically, definitely maintenance of intake-output chart plays a very vital role here to identify the deterioration or the improvement of the client's health status. So a 24-hour continuous intake and output chart gives a very valuable information related to the fluid electrolyte balance for the body. An accurately recorded intake-output chart or flow sheet definitely can identify the sources of excessive intake or fluid losses. Even intake should include or intake chart should include the oral intake, the IV fluid administration or intravenous administration, tube feeding, even retained irrigants. So this all has to be mentioned over our intake output chart. Output chart basically includes the conditions of perspiration, wound or tube drainage. Even if the client is having certain conditions like excessive vomiting and diarrhea, this all has to be noted down to find out or to indicate the exact source of the fluid volume intake and output. So as the nurses are maintaining the intake output chart, it is also very important to maintain the urinary output or the amount of urinary output here. The specific gravity also should be measured for our client whether they are present with a hypo or hypervolemia. Now, this all information definitely helping a medical professional to identify the condition and the improvement or deterioration of the health status of the client. Monitoring cardiovascular status, or basically monitoring the hemodynamic and vital signs for a continuous term, plays a very vital role here. As we have seen, the hypervolemia can alter the circulation for an individual's body. Now, even it can alter the perfusions of different body organs and system. That is the reason maintenance or observation of cardiovascular status plays here a very important role. Now, as a nurse, we should monitor the blood pressure, the pulse force, even jugular venous presence of jugular venous should be assessed. If a client is present with the jugular venous distension, we will be considering that the person is having a condition of hypervolemia. So that is how we are going to check for the blood pressure, the pulse force, even the pulse pressure, as well as the jugular venous and the other part or central venous pressures. So which will be basically indicating the client status. In volume excess, we will be often finding that the pulse will be very full and bounding and not obliterated. Increased volume also will be causing distension of the neck vein. Even the jugular venous distension will be seen here. Often the client will be present with increased blood pressure. So this all are the indications. So a nurse should write down and to find out the changes if there is any. Now, mild to moderate fluid volume deficit will be activating the compensatory mechanism, include the sympathetic nervous system mechanism. That is the reason often we are going to find that the client may present with a simultaneous of the increased heart rate. So this is basically suggesting that the client is already developed with a mild to moderate fluid volume deficit. So that is the reason why here nurses plays a very important role to find out initially the development or the risk of the development of fluid volume deficit. Now, the next assessment is the respiratory changes. So, as I have mentioned, the excessive amount of fluid volume or the fluid volume deficit both can alter the respiratory function for a particular individual. It is a nurse's role to assess their respiratory status and functions. In extracellular fluid volume excess, we are often going to see the patient can develop with pulmonary congestion and edema. They will be showing the presence of the increased hydrostatic pressure in the pulmonary vessels. That is the reason why often the client will be present with shortness of breath, moist crackles over auscultation will be very commonly found phenomena along with the condition of hypervolemia. So it is a nurse's role to find out any changes into the respiratory status at earliest to minimize the development of any complication related to the hypo or hypervolemia. So in case of fluid volume deficit, we are going to see the present or client will be often present with the increased respiratory rate. Even there will be decreased tissue perfusion and resultant hypoxia often. So these are basically the indication that the client is present with the hypovolemia. So it is a nurse's role to find out each and every findings and initiate the management at earliest to prevent the complication development. The next assessment should be done to assess the neurological changes. So excess fluid amount will be always causing a cerebral edema, from which there will be changes into the hydrostatic pressure into the brain or into the brain cells, and which actually can cause the cerebral edema, which will be alternating the level of consciousness, even the neurological status of a particular individual. Now, simultaneously, the profound volume deficiency often will be disrupting the perfusion to the brain, and which will be ultimately causing the alteration into the sensorium. So in both the cases of hypo and hypervolemia, there is a chances of the development of neurological symptoms for a client. That is the reason a nurse should be very vigilant enough to find out the changes that is occurring in the neurological system and symptoms related to it. So that will be basically helps to nurse to identify a change in the fluid volume at earliest. Definitely, we are going to see the assessment will be done definitely for the level of consciousness for a client. Even the Glasgow Coma Scale should be assessed at a regular interval. The client should be assessed for the voluntary or involuntary movement if it is present. Along with this changes assessment, we also have to perform a daily weight measurement, which will be basically indicating whether the client is losing or gaining weight. So for a client who is present with excessive fluid volume, we are going to see the client will be definitely having a increased weight. So management should actually reduce the weight of the particular individual to its normal level. Then only we are going to say that the client is responsive towards the treatment what we are administering to manage the condition of hypervolemia. Same like this, in case of hypovolemia, a person often will be reduced with their weight. So a proper medicine or a proper treatment therapy towards the hypovolemia considered that the client will be maintaining their proper weight at a regular or at a normal level. So it is a nurse's role here to measure and to do a proper assessment for their weight. Skin assessment and skin care also should be provided to the client here. In both of the cases of hypo and hypervolemia, we are going to see the person will be attaining certain changes into the peripheral skin, as well as they will be having a high risk for the tissue integrity or skin integrity disruption. That is the reason the nurse here plays a very important role by performing a regular interval skin assessment, as well as by providing sufficient skin care to the client depending on their disease condition and depending on their need. So other nursing measures along with this assessment and care also includes the monitoring of the rates of the infusion via the intravenous fluid, or the intravenous fluid solution has to be observed. Nasogastric tube insertion and irrigation also should be done with the isotonic solution only. So it is a nurse's role to ensure that the client is not having any alteration into their fluid electrolyte balance due to the nasogastric tube irrigation. The next, definitely we are going to see a continuous intake output chart, a vital signs monitoring, hemodynamic status monitoring should be ensured by a nurse. A nurse also responsible here to promote a proper rest and sleep for the client, as well as to ensure that the client is following a proper dietary measurement. If there is any prescription of the medications, it is a nurse's role to make sure that the client is adhered to the medication regimen. Even IV administration or intravenous administration of fluid and medication should be done properly at a regular interval by the nurses. So I hope till here you are completely aware about the fluid imbalance, if it is occurring, what can be the causes, what can be the clinical manifestations, as well as the basic treatment for both hypo and hypervolemia, as well as the basic nurse's role to manage the client with hypo or hypervolemia. Now, we're going to read in detail regarding the imbalance if it is occurring for electrolyte. Now, in this session, we are going to learn regarding every electrolyte and if it is present in excess or if it is present in a deficient amount, what will be the causes, what will be the clinical manifestations associated with it, even the basic treatment modalities to manage the client, and nursing responsibilities to manage the client with electrolyte imbalance. So thank you for listening to the session where we have discussed regarding the fluid volume excess and deficit and its necessary management. So stay tuned for the further discussion what we are going to discuss regarding the electrolyte imbalance in an individual's body. Thank you. We'll see you guys in the next session.